This question is directed to all candidates. And how will you address the Millennium Development Goals and help troubled youth specifically in regards to the issues of abortion laws and affordable housing?
Thank you for your question, Paisley. The Millennium Development Goals, of course, are Canada's commitment internationally with the family of nations to fight poverty globally. The original target to fight poverty, 0.7% of GDP to overseas development assistance, was chosen by Lester Pearson, our former Prime Minister, at a UN commission, and Canada's falling woefully behind. In our platform, we actually include how we meet those goals, how we pay for those programs, and we do it fast. This leads to the link to your next point about abortion. We know that the Canadian government has followed George Bush's policy to say we won't pay for abortions overseas. We need to protect a woman's right to choose, protect right to legal, accessible, safe abortion. We need to do much more to help our youth. We need much more counseling. We need support for youth who are feeling issues of mental health and depression and addiction issues. And we need to make it part of our Charter of Rights and Freedoms that we have the right to shelter. And our platform also includes an ambitious, serious program of federal government assistance to municipalities for social housing. Since we only get 30 seconds, I think I should mention that all the details of all our platform are online at greenparty.ca or elizabethmay.ca. They're fully costed, and it shows how we're going to increase programs for student bursaries, how we're going to increase the funding to post-secondary education. And on healthcare, we need to really look at ways to cut costs. And I want to take aim at big pharma. That's the single biggest area where our healthcare costs are rising. Pharmaceutical drugs are now 20% of the cost of our healthcare. We need to do a national program with a crown corporation that drives down the price through bulk buying and refuses to register drugs that do more harm than good.
My name is George Firestone, and I want to talk about health care. In Maclean's, it says, we are dead last in developed countries, the bottom of the list when it comes to timeliness and quality of care. Further on in the article, it says that we rank behind 24 European countries. We are falling behind the United States to the south of us in everything except expenditure. What can each of you identify as one issue in the healthcare arena that you would work on to improve, and how?
First thing is to enforce the Canada Health Act. The federal government has a responsibility to do so and to oppose two-tier medical systems and oppose privatization, and they've been letting too much go by. We need more beds. That's why we have long waiting periods. I mentioned that IMF report earlier. As a result of that, in 1994, in 1 year, we lost 20% of our beds in Canada in decisions across the country to close hospitals. We need to bring the beds back. We need more doctors. We need more nurses. We need to bring drug costs down, because that's the single biggest, fastest growing part of our healthcare dollar.
There's a lot of students here who will go on to university, but there's a lot who won't. And what disturbs me is that we need to we're not recognizing the value of labor, the value that every person in this society does. We can't do anything in our day without recognizing the labor of somebody who did something for us. We want to talk about doctors and nurses and giving grants to them. We need to acknowledge that the best surgeon isn't going to help you if that hospital isn't clean. And what do those people get? So how are we going to bring greater equality into paying for good labor?
Canadians are among the most overworked people on the planet. In fact, we have longer working hours and fewer statutory holidays even than people in the U.S. The Green Party is looking for balance in our society so that people don't get, we don't exist to be thrown like raw material into a meat grinder called the economy. The economy exists to be of service to humanity and to communities. We want to get that balance right. We want more flex hours. We want more statutory time off. We want people who do work to be paid appropriately. Child care workers, home support workers, and you make a good point about people in hospitals. We wouldn't have C. difficile if they hadn't been laying off all the people who were working on the cleaning and keeping our hospitals safe.